Welcome. My name is Elisa Fazzi, and I am a child neurologist and psychiatrist, professor at University of Brescia in Italy. I am the director of the Child Neurology and Psychiatry Unit of Civil Hospital in Brescia. I would like to describe the editorial New Clinical Needs and Strategies for Care in Children with Neurodisability during COVID-19, recently published on Developmental Medicine and Child Neurology. The impact of the COVID-19 outbreak in Lombardy has been particularly dramatic. We would like to share our first-hand experience of the challenges we have been facing and our attempt to remodel care delivery strategies in response. Social distancing has been adopted as the principal precautionary measure to prevent the spread of infection. Children's clinical services and social activities have been disrupted with the closures of medical centers, schools, and caregiving agencies. This strategy may not be easily achievable for children with neurodisabilities and/or psychiatric disorders. Not only do they require daily assistance and therapy, but need to face challenges to their daily routine. Maximizing communication is a priority. It is fundamental to support the virtual relationship between medical staff and patients and their families, especially when quarantine is the primary protective strategy. It is vital to employ all the technology available: phone, texting, email, video conferencing. In our unit, we have developed a strategy which provides continuity in care and treatment. There are 4 major strengths to our strategy: telehealth, telerehabilitation, call centers, and smart working. Telehealth encompasses telerehabilitation, telecare, teleconsultation, telemedicine, and remote non-clinical services. It involves the use of various information and communication technologies to provide medical assistance outside the traditional face-to-face approach from the hospital to patient's home. Telerehabilitation seems to be an effective, flexible, and individualized intervention, making it possible to save on costs. Patients and families reported a high level of satisfaction, reinforcing the hypothesis that the rehabilitative services at a distance is a feasible alternative to routine care. Telerehabilitation has been used in different conditions, but may provide a valuable approach in patients with neurological disorders, including children with cerebral palsy. Call centers are offering psychological and psychiatric support both for children and their families during the pandemic. They can be extended to a greater number of participants because they have low-cost infrastructure and do not need an internet connection. Telehealth and call centers both implement smart working, a useful strategy for reducing the risk of virus spread. It is a flexible approach to managing the workplace and timetables, allowing people to attain greater professional efficiency. The application of innovative communication technologies during the pandemic may turn into a useful tool in the future, after COVID-19, for daily clinical practice and treatment of children with neurodisabilities.